Hello everyone, this is Ruth, PharmD second year. Today's topic is walking cord syndrome. What is walking cord syndrome? Walking cord syndrome or Cotard syndrome is a rare mental disorder where individuals believe that they are dead or do not exist or lost their internal organs. It is a psychiatric disorder associated with severe depression and psychotic disorders. Key features include delusion of nephilism. Person believes that they are dead, they feel that they have no soul. Depersonalization, they feel unreal. Severe depression with delusional mind including suicidal thoughts. Refuse to eat and take care of oneself because they believe that they are dead, they see no point in self-care. Effects of this syndrome on the body include lack of pain response. Patients may harm themselves believing they cannot feel pain. Neglect physical health, they stop eating or drinking, which leads to malnutrition, dehydration, and weight loss. Social withdrawal and isolation, they often avoid contact with others, which worsen both mental as well as physical health. Immobility. In severe cases, they may lie still for long periods, resembling coma and paralysis. As you can see, these are some of the pictures which we can relate to the syndrome. Coming to the history of the syndrome, in 1880, the neurologist and psychiatrist called Julius Cotard described this condition as the delusion of negation, refers to the psychiatric condition with severe depression. Let us discuss some of the case studies to understand this syndrome. A French neurologist, Julie Cotard, saw a patient with an unusual complaint. She claimed to have no brain, no nerves, no chest, no stomach, and no intestines. She also believed that she was eternal and would live forever. Since she was immortal, she did not see a need to eat and soon died of starvation. Cotard's description of this woman's condition spread widely and was very influential, and the disorder was eventually named after him. Another case happened to be in 1788, where Charles Bonnet reported one of the earliest recorded cases of Cotard's delusion. An elderly woman was preparing a meal when she felt a draft and then became paralyzed on one side of her body. When feelings, movement, and ability to speak came back to her, she told her daughters to dress her in a shroud and place her in a coffin. For days, she continued to demand that her daughter, friends, and maid to treat her like she was dead. After she was treated, her delusions went away only to return every few months. What is the cause of the syndrome? The exact cause of Cotard syndrome is still unknown, but there are certain conditions which can cause this syndrome. Brain damage include stroke, blood clot, injury, tumor. Mental illness include depression, anxiety, substance abuse, schizophrenia. Some of the other conditions which can likely to cause this syndrome are dementia, epilepsy, migraine, Parkinson's disease, stroke, bleeding outside the brain. Risk factors include history of mental illness, depression, schizophrenia, substance abuse, brain stroke, blood clot in brain, injury to the brain, bipolar disorder in teens. Due to this syndrome, there are certain pathophysiological changes in our body, which include impaired insight, reasoning, self-monitoring, disordered body, lack of emotional response to self-recognition, reduced brain activity in frontal and parietal regions, severe depression, psychosis, bipolar disorder. Clinical manifestations include delusion of being dead, dying, or no longer exist, severe depression or sadness, insensitivity to pain, withdrawal from social activities, loss of interest, loss of appetite, lack of concentration, hopelessness and depressive emotions, anxiety, self harm or suicidal behavior, feeling as though one's body is decaying. These are some of the emotions felt by the person suffering from Cotard syndrome. Coming to the diagnosis, a person can be diagnosed based on the person's symptom, clinical interview and taking history, mental status examination. The physician may order blood tests, MRIs, EEG or CT scan. Treatment. The management of Cotard syndrome involves medication therapy or a talk therapy called cognitive behavioral therapy or psychotherapy. These therapies can treat Cotard syndrome to a great extent. Medications used in the syndrome include antipsychotics to reduce delusions, anti-anxiety drugs to reduce anxiety, antidepressants for depression, mood stabilizers to treat mood disorders. Electroconvulsive therapy can be preferred choice of the therapy in case of failed medication and talk therapy. Electroconvulsive therapy involves sending small currents through the brain. This alters the brain chemistry to relieve some of the symptoms. These were some of the references which I used. Thank you for watching my video.